welcome to Australia and welcome to ANU. It's been a pleasure to catch up with you all and just go through the medical insurance for overseas students in Australia. I work for Allianz Insurance, which is the primary provider of overseas health cover for international students in ANU. Well, OSHC is more of a complementary cover for students. So that means that we will not cover everything. We'll cover a certain percentage of medical expenses for overseas students. Of course, we are governed by the Australian government's regulations, and we have to follow what's been directed to us from the Australian government. So it has nothing to do with Allianz, but it has to do with what Australian government recommends, what should be the adequate medical cover for overseas students. So here I'm talking about how it works in Australia. So first of all, you have situations in a non-emergency where you have the doctor, where you actually see the doctor as the first point of contact. I recommend seeing students, the doctors at ANU Health Service, at the Union Court. They would be the first point of contact. The doctors would be able to recommend if any of these situations arises, if you need an X-ray or if you need to see a specialist or you have to have a pathology or radiology test. Or if it's too serious, you might have to go to the hospital. So the doctor at the ANU Health Service, they are the first point of contact for ANU students. That was non-emergency cover. Now we talk about emergency cover. Of course, your policies also cover you for emergency and ambulance services. In an emergency situation, we recommend students to go directly to the hospitals. There are two public hospitals in Canberra. One is Calvary at Bruce, which is the closest to ANU, and the other one is Canberra Hospital, which is in Warden. So emergency, so in Australia, we call emergency if it is a limb-threatening or a life-threatening situation, or if you are really, really sick and you can't go to the doctor. There you go to the emergency. Of course, emergency has a priority of attending to patients who are more serious, and there you might encounter some delays. At the emergencies, you've got all the services available, like X-rays, doctors, pathology, or even specialists. And even if you need a hospital treatment or you have to stay there for a couple of days overnight, everything is being covered at the emergency. So in terms of expenses for a hospital or an emergency cover, your policy covers you for emergency expenses. Right. I'll just go through overall, what your policy covers for you. Out-of-hospital expenses, like your doctors, pathologies, X-rays, radiology tests, and other expenses. In hospital, of course, if you happen to go to an emergency or you have to stay at the hospital, all these expenses with regards to your doctors or any tests required, as well as your X-rays or blood tests, they all are covered. The benefits are payable according to the Medicare benefit schedule. That is the Australian government with regards to medical compensation that you are entitled to. 100% of the Medicare benefit schedule fee. So if you happen to go to a hospital, especially the public hospitals in Canberra or around Australia, in Canberra, the Calvary and Canberra hospitals, so you are entitled to up to 100% of the cover. In case of a private hospital, there is a gap payment. So Allianz will cover your government fee, so the fee which is assigned to the treatment as per the Australian government's regulation. The private hospitals or private clinics or specialists, they generally tend to charge you a little bit more than the government fee. So the student will be required to cover that gap to pay for their private treatment or any specialist appointments. All right, so the most important part, I think, for me is the ambulance cover. Now, your policy definitely covers ambulance cover. So it is defined when it's medically necessary for admission to hospital or for emergency transport. Now, emergency treatment. So in this case, please make sure you take ambulance service if it is really urgent or when it is really required. For example, if it is life-threatening or a limb-threatening situation. So what that means is you either not able to walk, you're not able to stand, or the situation is gravely serious when you are basically struggling to breathe, or situations similar to that, or you have an accident. There have been students who have been charging ambulance, they've been using ambulance cover because they drank too much last night. They had serious hangover, they called an ambulance. Sorry, that is not covered. So you just be careful of how you use it, because it costs you upwards of $900 for each time you use the ambulance service. Of course, the claim got rejected for that one. Prescription medicines, under the Australian government's regulation, which is called the Pharmaceutical Benefit Scheme, your prescription medicines are covered. That is over and above the co-payment. So the Australian government requires you to pay a co-payment of $38.80 as per item on the prescription. So that has to be paid by the patient themselves first. Anything over and above that $38.80 mark is claimable. So, for example, if your bill is $38.70, sorry, not covered. If it is over $38.80 or $38.90, yes, you can claim, but can only claim 10 cents. So you have to pay attention to the co-payment. That's been described by the Australian government. That's been $38.80 from 2017. Of course, a maximum of $50 per prescribed item can be claimed for your prescription medicines. Right, and the exclusions in your policy, of course, physiotherapists, osteopaths, chiropractors, naturopaths, and other services. Well, adding to that, you are not covered to dental expenses. You are also not covered to ophthalmology or optical expenses. So any expenses related to your glasses, contact lenses, or any other related expenses will not be covered under your policy. Of course, your eye test, so basically checking your eye, the power of your eyes, is covered under your policy, but once every 3 years, or once every 36 months, that can be claimed under your policy. Over-the-counter medicines, like your Panadols, ibuprofens or Nurophens, they are also not covered. There has to be a prescription for each and every medicine that you are going to claim. Co-payments, of course, for the co-payments of $38.80, there is no cover. Pregnancy claims, yes, for most students at ANU, because your policies have been arranged through ANU, you do not have any waiting period for you or your partner's pregnancy expenses. And of course, psychological medications or psychological appointments, there is no waiting period for that. But for other cases, yes, of course, for pre-existing conditions, there is a 12-month waiting period. And of course, services and treatment which are outside Australia, arranged prior to arrival in Australia, received in the first 12 months of a pre-existing condition, and also covered by compensation or damage. These are also not covered. Now, I'll give you an example. If you happen to meet an accident and then you're injured, in that case, the car's insurer is the person who's going to compensate you for the accident. So this is a very, very important case, because a lot of students, they're riding a bike, they get hit by a car, something like that. They have to claim their expenses. They cannot cover those under OSHC, and they have to be covered under the comprehensive insurance from the driver of the car, and there's a CTP that's called the third-party insurance that is also compulsory when you're driving a car in Australia. So all those expenses related to your medical cover in terms of an accident, if you're hit by a car or something like that, it's all covered under those policies. Transportation services in and out of Australia related to your medical condition are also not covered under your policy. All right, so that defines your OSHC. If you have any further questions, I'm available on all days except Tuesdays at the campus, at the Student Center. These are the available times from 10 a.m. to 4 p.m. Please drop in. This is my email and website address as well. So please drop in, and I would be more than happy to help you out with your issues or with your any doubts or questions from today. And any other questions, or even if you drop in and say hello, I'll be more than happy to help you. Thank you.